We are going to go ahead and get started. Welcome, everyone, to today's session on how are you doing with water safety and some Evaluation 101. Can we have the next slide, please? For those of you who have been on these webinars before, as you know, this is done in a style where there'll be no camera or microphone for you to use, and that chat is the way for you to converse with us and share with everybody who is here on the webinar. If you can please begin by introducing yourself in the chat and give us your name and whatever affiliation or hat you're wearing today and where you are, what city or community, or if you'd like to share which community you work out of, please share that. And let's see, it seems like there was one other thing on that slide. Can we go back? Thanks. And the recording will be posted to the California Water Safety Coalition website afterwards, including the notes from the chat. So if you're trying to keep up with the chat, and as Bill and I are talking, you can also go back and refer to that afterwards. And let's go to the next slide. Bill?
All right. Well, thank you all for joining us. We hope that you enjoyed today's talk. Brief introductions. My name is Dr. Bill Ramos. I'm a faculty member at the Indiana University School of Public Health in Bloomington, Indiana. So on East Coast time here. Indiana, that always surprises people, but most of Indiana's on East Coast. I also oversee and I'm the director of an aquatics institute. And my career, I always call myself a pracademic by trade because I started out 30 years in the practitioner world, managing, operating aquatic facilities, started way back when as a lifeguard, worked my way through the system that many of you know, but then decided later, based on how many questions I had around our industry, went the academic route. So practitioner to academic, pracademic.
I like it. I'm Tizzy Bennett, and I was formerly the director of community health and community benefit at Seattle Children's Hospital and spent over 30 years working on drowning prevention specifically. I'm now a clinical instructor at the University of Washington School of Public Health, and I'm the co-chair of the Life Jacket, PFD, and other flotation working group for the U.S. National Water Safety Plan. And I would call myself a practitioner who has ended up doing a heck of a lot of evaluation and research. So I hope that Bill and our collective expertise will come together a nice package for you today. And next slide. Oh, and I see people are coming on and introducing themselves. Thank you so much. That's great for Bill and I to get to know you too.
All over. We've got someone on UK time, so we got a pretty wide breadth of experience in the room. Okay, so moving forward, again, we're going to talk about evaluation, and a lot of that's going to be around the topic of data. So immediately, again, this is a 101, so it's kind of ground floor. We don't know yet where your experience level rise, but as soon as people hear the word data, they immediately kind of take a step back because it sounds so official. But we're really just talking about numbers and words and things you may have already, things you may need to get, but data can come in all kinds of different shapes and sizes and configurations. We'll talk about evaluations and outcomes. We'll talk about the fact that why evaluation and the data you get from it are important to drive decision-making so that you can be the most effective. And Tizzy, I think we forgot efficient on here too, right? We're all looking in our workplaces to streamline, be able to pivot, especially coming out of a pandemic. So you can be effective, but also efficient. One of the biggest ones that helps us from making assumptions. So if we don't do evaluation and we haven't taken the time to really kind of survey the scene and collect information, oftentimes we write off just assumptions. And those can really leave our constituents, our participants, kind of with gaps in whether it's providing services or understanding the effectiveness of services. So it kind of takes a little bit of the guesswork out of it. And again, it helps you understand who you're serving and who you might be missing. The missing is definitely the gaps piece. And we're going to talk a little bit about the methodologies. And again, depending where you're at, that's another word people go, whoa, methodologies. We just mean how you're going to get the data. There's all different ways to do it. How you're going to collect the data. What kind of advantageous position does it put your organization? So many of us have to work with board of directors or city officials or some upper level group that we're trying to convince of a need. And this kind of evaluation and data gathering and interpretation can help make that case for us. And then we'll talk about some of the related tools you can use as well. Next slide. So we're going to start out with a few questions, and we're going to do the first question first. So just number one, and this is kind of help Tizzy and I get a little bit of direction and see where we're going. But if you have a thought in your head coming into this, or maybe even just from our initial conversation about what you hope to learn today, if you could pop that in the chat, that would be great. And we can give you a little bit of time to do that. So just the first question for now. We'll get to the other ones a little bit. So what are your hopes, your dreams as you come into a Evaluation 101 seminar today? And Tizzy, I don't know if you want to add anything there.
No, but I'll watch the chat for you, Bill. Everybody's pretty quiet so far.
That means we get to direct the hopes and dreams for the day, I guess. No, they'll come. Lower no budget. I think we'll talk about that later today. Again, this will give us an idea, as we know the presentation, what we've already kind of outlined and where we could possibly hit more.
We have what data points are most important to collect. As I was simulating this for myself earlier today, those first two questions were absolutely what I was thinking about as well. How to quantify behavior change.
Yeah, great one. I work a lot with behavior change.
And same. Who to share data with
Mm.
and not share data with. Okay. And tips on how I can do evaluation where we are currently, what we're currently doing, and ways we can use that evaluation to bring more awareness to our programs, or possibly use the evaluation to add budget to these programs. Absolutely thinking about that why factor. Those are some great examples of what you hope to learn today.
I think the majority there we're going to touch on, or at least weave into what we're talking about. A few kind of new ones in there, and I think we can find a place for those, Tizzy, as we move forward. Do you want to go ahead to number 2 and 3 then?
Great. So these next two questions, number 2 is, what questions are you trying to answer? And a little bit of that came through in what you shared about what you'd like to learn today. And number 3 is, what information do you already have? When you put your notes in the chat this time, please put the number 2 if you are providing a response to what questions are you trying to answer, and a number 3 with what information do you already have, so that Bill and I know as we are reading through the chat which question you're referring to. So again, answers in the chat, and this time put a 2 or a 3 in front of it.
And what questions are you trying to answer? It could be ones that you've already done and you're not sure how they played out. It could be something that's been churning, or it could just be something that you're planning on doing. So are there any, everything starts with a question, I guess. That's what I always tell my my research methods class. It all starts with the questions that are churning in our head. And sometimes we don't even know they're there, but when you start thinking about them, they've been nagging you. As I mentioned, that kind of drew me to academics to be able to understand how to answer those. But there are those things that keep saying, why is this happening? Or how would I do better at this? Those little thoughts that just maybe keep punctuating in your mind.
So here's one for question 2. What is the effectiveness or impact of junior lifeguard programs in California? Again, for question 2, we have a new water safety education card, a water watcher tag. What should we ask before and after to gauge if the information changed minds? It's great thinking about that pre and post, and love that. We have to know where we are to know where we're going or where we get to. How about a couple of more? Oh, we'd really like to know what information you already have. Here, let's hear some ideas for that one as well. Hope to hear ideas that spark thoughts towards improving water safety in my facility. And how can we quantify the impact of a specific program in ways other than just numbers of participants who have taken our class? It's great. And actually that numbers of participants may be information you already have and are starting with. And I have to say, at least being able to say how many versus there were a lot of people or hardly anyone showed up, that's already an improvement. Even just to have those numbers is a good starting place.
Yeah, and I'm intrigued because I'm seeing questions and thoughts around behaviors. So we'll have to make sure we target those. And I think one of the examples coming up hits that well. Behavior is a tricky one to put an evaluation around, but certainly possible.
Bill and I are both really into behavior change, so that's a good one for us. Are the children that attend our water sessions safer after attending? For question 2. And for question 3, we collect pre and post session knowledge of things like beach flags and what to do if they get in trouble. Water safety and measuring that, effectiveness of water safety camps versus junior lifeguard camps. These are a few awesome examples. I think what we'll do is move forward. Oh, I see one more come through from Will. For number 3, some contact information might already be gathered, like email, address, and phone number of participants. When you have an address, you know where they live, and you may know what kind of, then who you're serving and who we're not. And then one last one, and then we're going to move on. But these really help us with how to shape our conversation today. Here's one last one for question 3. We're tracking water competency during swim lessons on before and after skill competency. Again, awesome taking that time to know where you're starting. Great, thank you. Let's go to the next slide, and Bill and I are going to continue to monitor the chat.
All right, so these are kind of the big driving questions for the topic today. So what is evaluation? Why does it matter? What are potential stakeholders? If you're a practitioner, how can I do evaluation? And how can I do evaluation without funding, which I think was one of the questions that came through earlier. So, with evaluation, again, we're just talking about that bigger picture of collecting information at a variety of levels that's going to change and help us better understand a condition. And you've listed great conditions in here, effects of life jackets and swim lessons and programs that we're offering. Most of probably what we're going to be involved with on the call are the evaluations of programs and services. So things that we are out delivering to people. And whenever we're dealing with human beings, that always adds a whole nother layer to challenges that can go along with collecting data. And it matters because that kind of best practices situation we talked about earlier, it's great as long as best practices are developed based on information and evaluation, but we need to make sure that we're not making assumptions. So this idea that it matters because we want to be agile, we want to be effective. So if we continue to do something just because we're in the habit of doing it without ever doing an evaluation, we may find all that time was wasted. Or we find out on the opposite side that we're doing something incredibly effective and we can hone it even further, or that becomes energy and proof to people that it should continue, for those of you who might be sometimes having to justify programs. Tizzy, I don't know if you want to pop in on stakeholders.
When you think about potential stakeholders, I saw a few notes in the chat about what about when you're presenting to funders, and what about other people that you might be presenting your data to, and are there people that you shouldn't share your data with? And I think that is a very good question, and thinking about how to shape evaluation to be as transparent as possible while still protecting the privacy and confidentiality of the people that you are evaluating. So there is very much that balance, and that's one of those things to keep in mind, and where partners like university faculty such as Bill can help with that piece of it.
Yeah, I would say, at the university level, we have the internal review board, which certifies and approves research to make sure we're not injuring or harming individuals, which includes, identifying them. So certainly I would say at all levels, collect the data you need to, but then de-identify as far as you can. So for example, if you're doing a pre-post survey, you may need to know a child's name to be able to match the pre-survey up to the post survey. But at some point, you need to limit who has that information. And then at some point, those names can be coded to numbers. So then they just become numbers that are matched. So there definitely are instances. Someone said zip codes as well, and zip codes can get a little bit iffy because, I mean, they seem pretty general, but depending on the area that you're collecting them from, they can pull into a pretty targeted area for somebody. So again, just thinking about how to always protect individuals, their rights, their privacies. There are all kinds of methods to de-identify and make sure that it can't, the goal is always to make sure it cannot be tracked back to one specific individual.
And the last note I would just add about what you share and not share, it can be very painful to share when you have learned that something is not working. And sometimes we feel like, oh gosh, we don't want to let anybody know that. But at the same time, this is the opportunity to say, we have learned and we have learned some things and we want to do it better. And we've got some really good ideas that we've learned from our evaluation for how to do things differently, how to do things better, or that we need to change direction. So always use failure as a learning opportunity. Lean into it.
Yep, agreed, totally there. There's lessons learned on both ends of data. And, I think if data were to show something you weren't maybe as pleased about, it also shows your ability then to create a plan to improve. And then you go test that and you show improvement. And that's also powerful. One thing we deal with in the water safety drowning prevention community is the sharing is almost crucial because we have so little of it. And that's one of the things we're working on the National Water Safety Action Plan are these large cohesive systems to allow people to pull data together, because it's hard to make big grand decisions when we have a little piece here, a little piece here, a little piece here. We need a lot of data to come together. So willingness to share and knowing what to share, I think, is important. And Tizzy, I don't know if you want to talk about the without funding piece.
I have done a lot of evaluation without funding. And that's when being able to bring together partners and that 1 + 1 is more than 2 opportunity where everybody puts in a little bit and then you can actually look at what you can evaluate, and also to think small and to start where you can and to look at what you have. And also the last piece I would say is really honing in on what you really want to know. There's always a lot of things we'd like to know. And then that stretches your resources more thinly versus really being able to hone in on what you absolutely need to know.
Yeah, we are in an interesting phase, at least again, right now, I'm in the academic side more, and we are having a bit of a bump because people seem reluctant or have been conditioned not to complete a survey, for example, without an incentive. So that can be a little bit tricky. But when you have an invested population, if you know you're going for parents of your swim lesson kids, they're invested, they're going to answer a survey. I recently did a study related to the Red Cross, and we went out and surveyed their authorized providers. And without even an incentive, we had thousands of replies. So knowing your population, and if you're doing an evaluation that you know people can get excited about or are interested in, that can go a long way as far as making sure you get the responses you need. We ready for next slide? All right, so again, back to our kind of 101 level, we typically think of evaluation in 3 stages. The formative evaluation that asks what exists now. So we're kind of surveying, and if anyone is, I'm sure a lot of you have been in the aquatic business for a long time. We used to say in programs like when you walk up to survey the scene, right? So formative evaluation is your community needs assessment. Your, the idea of what do people know, what do they believe, and what do they do now? What do they have now? How do they perceive your programs now? Knowing that as a benchmark or a baseline is crucial, especially if you want to show change, right? So we can't, and this is a great place where we make assumptions. One of the classics is we get all excited internally in our silo and we create a program and we put it out and nobody comes. And then you start asking then, and you find out it wasn't on anybody's level of interest, or there were these barriers involved, or it simply just wasn't a desired program. So the formative evaluation is kind of it's your first step in just kind of surveying the scene and just collecting whatever you can to see where things are now. Then we move into process evaluation. What's your resource, program, or service implemented? Was it implemented as planned? So going step by step through the process. Again, we have a lot of people that are involved in event delivery and program delivery, which is actually part of the program I'm in here at Indiana University. And we're always telling our students, you have to map those things out, right? How did it go step by step? What worked, what didn't work? Each of those individual pieces help develop the evaluation plan. And of course, at the end, we're always looking for outcomes. And a lot of people will skip 1 and 2 and go to 3 and think they've measured outcomes, but you can't measure an outcome if you don't know where you started. So again, that kind of first step is important to coming out of the end with your impact or evaluation. And then within that, of course, we have different ways to get data. And we're going to ask you in a minute, again, kind of what data do you have? We know, and you may or may not know, so we either usually go quantitative data, concrete numbers, information, surveys with a Likert scale, how happy are you, 0 to 5. The quantitative data is great in many ways because there are a lot of statistical ways to kind of look at it. We can do frequencies, and say how many of this, how many of that. One of the downsides I would say of quantitative is it does put people in a box, a proverbial box, because once you create a survey and you've created those options, they're kind of trapped in there. But it's succinct, it's easy, and it's very data driven and easy to compare to other surveys that may be similar. And then of course we have qualitative data, one of my favorites, and I think Tizzy's as well. So here we're getting people's own words, or we're looking through documents that maybe have some history to them. So it's more word-based. And where I like qualitative data is it gives life to the quantitative data in many ways. We might do qualitative research, ask people questions in the formative phase so that we don't miss something when we get to the quantitative phase, right? So if it's a question that you're really not sure about, even how to design a survey, go ask people what they think. They'll guide you towards what should be on that survey. It can also go the other way. So you do a mass survey, and sometimes you end up with more questions than answers. So why did people say this? Now we got to go a level deeper. That's kind of my favorite approach. Take the quantitative, see where the questions lie, the deeper questions lie, and then go find people or documents and those words and those expressed feelings, and then interpret from that end.
So evaluation can be about what was successful and or unsuccessful, but also simply what did we learn? To Bill's comments there, it really helps you on your path of the continuous learning path and how can we keep getting better.
Yeah. Just a quick note, because I'm not sure where this would go in, but I want to address the people that talked about behavior. Behavior is tricky, right? Because it's not as easy to show as, say, you watched a skill pre, now you watched a skill post, and you can see a difference. But we definitely have tools to do that. A lot of them a lot of processes are usually done through scenario type questions. So asking people, how would they do something? And just quickly, and I'll throw this in the chat, I'll look it up maybe near the end. There's something called the reasoned action approach. And it's a research style that asks predictive behavior questions. Because I think what some of you were alluding to is we do these programs and we collect knowledge, but what we tend not to know is will they use them later, and will they act later in the appropriate manner when they encounter, for example, a drowning situation. And the reason action approach gives you certain tools to do predictive behavior assessment. So yes, they didn't know reach or throw, don't go. Now they know it. That's the knowledge piece. but we could also do a predictive behavior piece at the end, a few questions that help us kind of determine if they're going to use it later or not. So just an example of how behavior can be assessed. Next slide.
So now I'd like to give you a few examples to make some concrete, put it into action about how we go from program or from learning to help us do our work better. So I have 3 examples I'd like to share from work that I've been involved with or partners that I've worked with in the Seattle, Washington state area. The first is Seattle Parks and Recreation Aquatics Neighborhood House, which is a community organization serving culturally, racially diverse, low-income families and the last youth from the community itself. The goal was to increase diversity in attendees and staff at beach and pool programs in Seattle. And so these were some of the things that were measured before, during, and or after. One was the number of lifeguarded beaches offering free swim lessons in the evening versus the day, and the number of attendees. If you're working a couple of jobs and you're running around all day, it's really hard to get your child to the 11 a.m. free swim lesson at a beach, even if that's the most convenient time for lifeguards to offer it. How about number of lifeguards and swim aides from diverse backgrounds? We know hands down people want to see themselves. They will feel more comfortable if they see themselves reflected in the people who are serving them. Number of diverse young people trained to be lifeguards, pools with single gender swim. There are some people either for personal or ethnic, cultural, religious reasons have to swim in a pool with a single gender. And this is all about increasing access to diversity. And then number of swim lessons and scholarships by pool and by race and ethnicity compared to census and who's drowning. And the reason for that is sometimes we learn all about who we're serving, and then sometimes we don't ask ourselves the question about how about who's not coming in. So if, for example, my community has 30% of the community identifies as Black or African American, but only 5% of the people that we're serving in our swim programs identify as such, then you know there's a mismatch to your community and the potential for who you can serve. So here's a few examples of results. We learned from focus groups. So that's that formative evaluation that parents really struggled to get to free swim classes at the beach when they were offered in the day. One beach served 20 kids a year before switching to an evening program. In 1 year, they served 400 kids. The number difference was just astounding. The women-only swim sessions have been offered now for almost 10 years at some of the Seattle public pools, and they've been sustained over time and sustained over some challenges to having that. Number of lifeguards representing different races and ethnicities has increased significantly, and in part through a free lifeguard program that was focused on youth starting with less proficient swim skills. We know kids from diverse backgrounds are less likely to swim in the first place. So the most success has been shown through implementation of a peer-taught teen program focusing on beginning swimming skills right through lifeguard training. These free programs reached out to kids reflecting the community they didn't typically see in swim programs. The peer-led component really encouraged, participation of staff in that age group and has become self-sustaining over time. And while it began with partnering by community organizations, eventually it was the teen staff and participants who really became the best promoters of the program and really engaged. The current staff at Rainier Beach Pool, which is where this has been most successfully implemented, now shows a benefited lifeguard staff made up of almost entirely of BIPOC youth who came from this program and who live in the community. And more than 100 lifeguards have been hired out of this program since 2014 to the present. I know everybody's got lifeguard shortages out there, so just think about this way of creating such a great opportunity. And next slide. So this next example is a partnership of Public Health Seattle and King County, Seattle Children's Hospital, No More Under, which is a small nonprofit organization, and Mother Africa. And the goal was to increase access to safer places to swim and increase the use of properly fit life jackets. So some of the measurement here is looking at the number of lifeguarded beaches and designated swim areas in Seattle and King County, because we know those are safer places to water recreate. How about the number of sites with functioning life jacket loaner programs? Notice I use the term functioning. If there's no life jackets there, if they're not serviceable, that is not a functioning program and people won't be able to rely on it. The number of fatal and non-fatal drownings with follow-up for children and teens, that's part of child death review. And we do want to take a moment to acknowledge that some people on the call here today have been personally impacted by drowning, and just this work is so important to seek to understand so that we can create safer water environments and prevent drowning in the future. One of the outcomes of work doing child death review to understand better was to come up with policy recommendations. And one was to actually close a waterway to swimming in the Seattle area. And since it was closed to swimming, we have not had a drowning in that waterway. That really came out of learning and making policy change. Number of properly fit life jackets distributed at events. So you have who came, and then you have your number of life jackets and were they properly fit? And then what did people report before and after in terms of, did they have a life jacket that fit? How confident did they feel? Those are two things that we know from other evaluations that lead to behavior change, and measuring those right there at the event. Piece of paper, can you take a few minutes to fill out a couple of questions, and putting it on an Excel spreadsheet and just doing frequencies or numbers, even without big data analysis, helps us learn. And then our last example, we can go to the next slide. This is Washington State Parks boating. The Washington State Department of Health, U.S. Coast Guard Auxiliary, Seattle Children's Hospital, local Parks and Marine Patrol, JSI, which is a national firm that conducts the boating-related life jacket observations for the U.S. Coast Guard. Goal has been to increase life jacket use. And part of the measurement done on a periodic basis is to observe how many people are wearing life jackets in boats, and what about life jackets or other types of flotation in designated swim areas? And then what are the attitudes and beliefs of boaters and swimmers observed to be wearing or not wearing a life jacket? One example of how we did that is we observed with binoculars, and then as those boats came in, we had someone survey them as they're pulling the boat up on the boat ramp. Hey, do you have a few minutes to answer a few questions? And then we learn right there those boaters and what we saw their behavior to be, and then what they told us about what their attitudes were. And one of the things that we know, and for all of you working in that life jacket space, depends on the boat, depends on the age, depends on lots of different factors. One of the things that we learned from observations is that children and teens are more likely to wear life jackets if the adult in the boat is wearing one. Well, that transfers right away to messaging. And what are we doing to promote adult role modeling as such an important message to get out there? If you as the adult is not wearing a life jacket, hey, guess what? Your teenager is going to be way less likely to wear one as well. I'm going to turn it back to Bill.
All right, and next slide. All right, so just a few thoughts on next steps. A lot of people, when they're first getting involved in evaluation, for example, will just feel overwhelmed, don't feel they have the tools, don't feel they have the knowledge or the resources. So think about who are your partners and who you can collaborate with. Of course, I'll put academics on the table. A lot of the work you're doing and a lot of the work you listed would be incredible opportunities for academics in the field of public health, in psychology, in pediatrics, in so many areas, there would be people. So make those connections. And again, even those may sometimes seem a little bit difficult. And they don't even have to be in your own backyard. I do research all over the country and the globe. Just somebody usually has to reach out, and I'm like, let's do this. Let's make this happen. And then they also could have the funding mechanisms to help you as well. And then collaborators, these could be, it doesn't, so take academics off the table. You probably have hospital foundations doing this type of work. You probably have people working in the city departments that are doing evaluation work. There's all kinds of people in a community that do evaluation and would have the tools. So if you're feeling a little bit intimidated or don't know where to start or what kind of methods or process you might use, make a partnership and start collecting data. I think it's probably more in your backyard than you think.
There's a really great journal called the International Journal of Aquatic Research and Education. And one of the nice things about that journal, it's open access, so anybody can get a hold of it. And there's actually a lot of practice-related examples of people trying to get out there and evaluating. There's also lots to learn in the literature itself. And I know that can be a barrier for people who don't have access to get to journal articles. That's when you call your friends who work in healthcare or who work in university settings and say, hey, I saw there was just an article that's been published about evaluating water safety programs. I can't access anything except the abstract. Do you think you could get a copy for me? So definitely that's one place to tap your partners and other people that you work with. I also want to give one example of a collaborator that is maybe thinking outside of the box. One of the things we do in Washington State is to distribute life jacket discount coupons. And we work with a retailer called Big Five Sporting Goods. And they, from May to September every year, they give us the opportunity to print a coupon for 25% off a life jacket. And then on the back side of the coupon, we have messaging about how to properly choose and fit a life jacket and a few messages about using and wearing it. Well, we knew, we had some sense, gee, we gave out 1,000 at this event, or we gave out, 10,000 coupons, and gosh, we did a really good job. Well, really, the measure of success was how many of those coupons were redeemed. And we learned, working with Big Five, that has really been taken time, and sometimes they have time to do it and sometimes they don't, but to not give up on that. And to also, if you're working, for example, like with a retail setting, is to not just go from, oh, we got the coupons out and oh, gee, maybe we can get a count at the end, but how about a month in to go and visit like your local? We would go and visit our local Big Five and, hi, can I talk to the manager? Hi, my name's Tizzy and we're doing the coupon program. I'm wondering, have you seen those coupons come through? Do your staff have questions about it? There's ways of really making connection and learning during as well as on either end. And Bill, back to you.
All right, next slide.
So we're going to finish with just a couple of evaluation tools that we think are great for next steps. And we know that you all have this opportunity to learn from each other as well. The first is from the Centers for Disease Control, an introduction to program evaluation for public health programs, a self-study guide. So if you're really interested in improving your knowledge and your ability around evaluation, but just need to do it as you can fit that time in, this is a great resource for you. The second is from a quite an amazing resource called the Community Toolbox out of Kansas University. And if you've never looked at this site before, there is anything and everything on this site about doing programs, including quite an extensive section on evaluation. And then the third is a collection of resources that's been compiled by Safe States. And so we give you those links just as a few other ideas for you. And I can see that there's some other, I see a post on the chat from, this is coming from Will, I think, program evaluation for public health programs. That is a great one. And so these different resources that you have, please keep sharing those out as you learn what they are as well. And on to the next slide. So we're going to finish.
Go ahead, Tizzy.
Okay. We are going to finish with, again, opportunity to give us some feedback in the chat. What is one thing you plan to do as a result of attending today's session?
Pretty quick, but we're hoping we put some nugget upstairs to be thinking about.
Oh, Mary's going to Big Five.
Big Five, there you go.
I've actually worked with a lot of retailers around gun lock boxes, booster seats, bike helmets, life jackets. Working in partnership with your retailers is a great way to get items out there and to look at how they can help you with measurement.
Yeah, I don't know what the experience is with everybody else on the call, but with our topic, I've rarely found someone that'll just turn away. It really does resonate with people as something they feel good about being connected to and something they want to work with.
I see a chat on increasing that messaging around adult role modeling. You know, those kinds of things, when we learn what makes a difference in people practicing a safer behavior, then that really transfers into how do we include that in our water safety education programs? How do we include that in our media messaging? How do we include that in our outreach? I see reference to learning about theory of reasoned action. I use that one a lot as well. And there are some really good examples of how it's been used in injury prevention. And I would be happy to, Bill and I could actually do some follow-up after this with some examples of some resources for those who are interested in learning that. And maybe we could share that out through the coalition for those who are interested. Let's see, what else do we have in the chat there, Bill?
Connection to academics, love that one. To get a script for a program on campus and can be used by swim club to speak about water safety, great. Think a bit more about indicators that are already available. Don't reinvent the wheel, right? There's a lot out there. So shake the trees a little bit and it's there, or ask. People are willing to help. And adding comfort level questions. We're reviewing water competency skills, but not asking the swimmers how they felt, right? So going, and I don't know, is that a quantitative? So you're going to ask, you're going to give them a scale, or are you following up with qualitative? So really get to the heart of it. And again, you may do it on a survey somehow and then go, we just need to know why they are all answering this, and go into the maybe go into qualitative to get that deeper moment, especially with kids. Some of my most memorable data collection moments are face-to-face with children. They will tell you exactly what you need to know. So if you're working with kids and haven't gone into a qualitative setting, I highly recommend it.
And I have to say that one around confidence, that is also one of my very favorite behavior theories and constructs to grab onto. And that is a concept called self-efficacy, or your confidence in your ability to do something. In many, many different behavioral settings, and Bill can speak to this as well, it's been demonstrated that people are more likely to do something when they feel confident that they can do it. So let's use as an example, let's just say you have a group of kids in a swim lesson, and you're just noticing that, you know, your kids are really in this varied places of their ability to do a certain component in the swim class. You could even ask in a very, just right there and then, hey, on a scale of 1 to 5, how confident are you that you can go from this side of the pool to that side of the pool? When you have a kid telling you a 4 or a 5, they're pretty darn confident that they know how to do that. Now, are they overconfident? That's another question, but that might give you information that then to say, what about that kid who says 1? Okay, well, how about if we start here? How about, can you swim from the side to me, just barely out of your reach? Hey, what would be your number there? I'm a 5 on that. Great. Let's see how you can do. And you can get a really nice sense about people's comfort. And again, that is closely tied in many settings to actual behavior change.
And I think we're finding in the aquatic setting, the language we use and the understanding at different points varies. So finding ways to triangulate between what parents say they think their child can do, what the child thinks they can do, and then actually testing the skill and looking at those three. I'm just finishing up a study looking at that exact thing, and the gaps are just amazing. So, you know, how people are perceiving what we're saying when we say, can you save yourself? You know, it means different to a host of different people. Or can you do this? It can mean a host of different things. So by having different viewpoints and then putting them together, it can be really enlightening.
And actually, Bill brings up an important point that in your learning journey, if you are using questions or an approach that hasn't been used before, one of the things that we haven't touched on today, but that is really important, is something called pre-test, where you test first on a small number to see whether people all understand the question in the same way. Or are they, does everybody answer the question? You're always getting the same answer. If there's no differentiation, then is there some other way to word a question? Because maybe that's not so helpful if everybody's already telling you the same thing. So for example, we have included questions on swimming and on life jacket use in the statewide Healthy Youth Survey, which is like the Youth Risk Behavior Survey in other states. In Washington, it's called the Healthy Youth Survey. And we, I believe we started it by saying, how often do you wear a life jacket in a boat? And we went with, you know, all the time, because that would mean 100%. More than half the time, well, that would mean 51 to 99%. You know, so we try to put a little bit of numeric to what does all and most of the time mean. But also one of the things we learned after we had asked like thousands of kids, we didn't do a good job pre-testing, is, whoa, it depends on what kind of boat, and it depends on what size of boat. And so then we switched it to be when you're in a small boat, such as a canoe or kayak or rowboat, because that's really where the risk is in these smaller boats. And so learn from mistakes has definitely been part of my journey, and I'm sure the journey for all of you, but the pre-test is very important. And one of the other things about pre-test is different cultures understand and respond to a question in different ways. So even if you've asked some group of people, and then you go out and talk to another group of people who have different background, might be rural and urban, it may be race and ethnicity, it may be language, their first languages other than English, their interpretation of what you're asking, while it may seem very obvious to you, is not at all obvious to them.
Yeah, and I like that the learning journey. I've been on that as well. So I could think of several studies where, and we often call that a pilot study too. If we hadn't done that early testing of it on a smaller group, we would have found out at the end we collected a bunch of data that wasn't worth anything, right? And I've been on the back end of that, where at the back end we say, oh my gosh, look at this question. I don't think people really understood it, and now that data becomes kind of worthless. So it's definitely worth trying it out, and the pre or the pilot is just a matter of trying it out with who's ever going to be invested in the survey. And like I said, kids are always worth trying things out on, because they will call you to the carpet on things that don't make sense or that need tweaking.
We have a few more minutes today, and we did want to have an opportunity, and we could go to the next slide. We wanted to give you an opportunity to share other questions that you have, or if you have reflections that you'd like to share based on what we've talked about today.
And Tizzy, I don't know if you're reading the one from Mary Downing on the call. Can you give a rip current education type example for teens? We had a teen drowning at the beach this summer. The family, recent immigrants to the US, said he could swim.
And trying to figure out what is the way to ask that question is something that a lot of people have been trying to sort out. It's one thing to see what people can do. It's another thing to try to get at that right question. There actually are a few evidence-based ways of asking that question. We're getting a little bit closer. One might be, has your child had formal swimming lessons? There's been a study published that was actually tied. Kids who had had formal swimming lessons were less likely to have died from drowning. And so that is one. And then also, how well can your child swim? Really good, okay, not so good. Trying to get at that. There are a few papers that we can send you. And I'm sorry for that you had that happen to a teenager. I do think in that case of rip current that it is certainly one of those things that people need to actually see what it looks like, and they need to get a better sense than being told what it looks like and what they need to do. That when are those opportunities that you can hear a message and maybe be able to know what that means versus you need to see that message or experience it yourself.
Yeah, I think we have work to do on rip current education. Tizzy, you're right. There's a gap between the diagrams and some of the realities. And of course, with rip currents, and I apologize, I don't know of any current like standalone rip current education programs. Many are tied in with other programs. I think there was one recently, there's at least a video posted by the Great Lakes Surf and Rescue Program that mentions it. But, thinking about he could swim, I mean, with the rip currents or sort of situation, being able to swim isn't the panacea there either. So there's all kinds of different factors that can come into play.
And part of that learning, and I'll stay with rip currents for a second here, is that if we know actually swimming out of a rip current is not an easy situation at all, is that really, does that stand alone as the way that we are going to provide water safety and drowning prevention outreach? Does it actually need to be coupled with a clearer message, which is don't go in today? The rip currents are high, just like you see flag situations at beaches, whether it's California or Hawaii or wherever that might be, that is saying, don't go in the water, there are rip currents. Then that takes it out of, for me, going, is that a rip current out there? I don't know what that looks like. I look at the diagrams of all those arrows going and know if I get caught, I'm supposed to keep swimming for a long ways. I mean, it is complicated. And so part of that learning is, what does that tell us the message is? And I'll go back to that Vietnamese example that I used earlier. Is we learned from the families that we talked to, as most parents we spoke with who are Vietnamese, they did not swim themselves. They weren't going to be the ones to go in the water. They would not be comfortable with rescue. They weren't going to have a swimsuit on. They'd be fully clothed. And we realized that that message we were using about supervising your child, was that really what we needed to be really emphasizing? And what we did is we embedded that within, you need to swim in a place with lifeguards. That's what you need to do, because then if a rescue is needed, there is someone there who is trained and can help you. So we learned that from formative evaluation to then put that into our programming. And then when we measured at the back end, that was actually one of the things that people reported that they were doing differently, was swimming more often in a lifeguarded area.
I think if we're waiting, go ahead.
Tizzy and Bill, we have a question from Mary Downing. Mary, you can go ahead and ask your question.
Thank you so much for jumping in on rip currents, because this was a heartbreak in San Diego. It was a teen the day after graduation, the day of graduation, and it was a triple drowning, and 2 were rescued and 1 is still lost. And beautiful day, lifeguards on duty. They had to walk, everybody has to walk past the rip current, poster from NOAA. And but the question you're talking about, the questions, is just really, really important, maybe to all of us. That how can we ask if people read that sign, or could you save yourself, or do you know what parallel is when you're
Yeah, you're right. The use of the semantics in the language, and age, how many people would know what parallel means, especially if you've just, if you're a recent immigrant and the language is even challenging to begin with, right?
I can give you an example of what we did with the life jacket loaner station. We were trying to evaluate the standard sign that we had up, that we were trying to promote the use of in Washington State. And we were able to recruit some student volunteers. They were public health students. They wanted a project. And what we did was we came up with some questions that we wanted to know from people who were at beaches that had life jacket loaner stations. And they just like walked up to people who were sitting there on the beach, not to people right there at the loaner station, just people who were there at the beach. Hi, my name's Tizzy. I'm wondering, do you have just a minute? Can I ask you a few questions today? Yeah, sure. Sure. They're not supervising their child in the water. They're just hanging out on the, on their towel, and would say, did you see the life jacket loaner station over there? Oh, geez, I didn't even notice it. Or yes, I did. Oh, did you borrow a life jacket from it today? No, there weren't any life jackets. Oh, that's informative. And then we asked, do you have any comments about what was on that sign? Was there anything? Tell me what you thought you needed to do, or was it clear? We got so much great information out of that. And that was students. We asked 100 people. We put it on an Excel spreadsheet. We wrote in all the open-ended feedback. And out of that, we then revised the board where we more tightly clustered photo to instructions. We were able to provide best practices out to life jacket loaner stations around the state and nationally. These are the kinds of things that are going to make people use those loaner stations. So that's an example of, like, to your sign example. And I do want to give a caveat that we actually don't really know that signs work. So this is, is it a sign? Is it what you have educated people? We need to put so many layers of safety into place. But that's an example of, get out there on the beach one day, get your survey together and see what you can learn. Doesn't always have to be a case control research. There can be lots of opportunity for learning where you're at and then being able to set up an evaluation.
We did a recent study with the city of Gary with a community action group who sent out over the season, about 15 different messaging opportunities, from a bus placard to a bench outside a restaurant, to billboards, to sessions handing out information. And then we did a survey. We got about 2,000 responses, and we asked people, click below where you encountered water safety information this summer. And believe it or not, people could remember seeing where they saw something. But then we said, you identified you saw the billboard on the street. What did it say? That's when the gap occurred. They could remember seeing something and got it right. There was a billboard at that location, but then they couldn't go to the level of telling us what the message was. So we're trying to think through, and some more than others. So for example, the bus was the least effective. But we found out that things closer to the area, as the marketing or the messaging got closer to the actual beach, then the number of people could respond and remember what it was. And the number one, Tizzy, you just hinted it, was when people handed information out, when they did beach safety days and they handed physically people things, they remembered what was on that safety information.
That's such a great example. I know we're just about at 1 o'clock. I'm wondering if we can go to the last slide. we really want to finish by thanking you for joining us today and for all you're doing to promote water safety and prevent drowning in California. I've learned a lot just reviewing the chat today and look forward to really taking a look at everybody's comments and questions afterwards. But please feel free to email Bill or myself directly, or feel free to reach out to Will and say, hey, I've got these questions. Can I connect? We'd be happy to at least help get you down the path towards where you might be able to find out more information.
I think my final thought would be just, you have data, it's out there. We didn't get to hit on it as much, but take a survey of everything you collect. There's probably more out there that can tell a story. For example, we found out that the ticket taker at the parking lot, recorded license plates. So now we have a sense of who came to an area. You have membership forums, you have complaint forums, all these pieces of information you may not be thinking about are data, and hopefully you can look at those and find something meaningful you can do with them. Thanks
Start
again
with
for
what
your
you
time.
have.
There
Yeah.
you go.
Thank you so much, everyone.
Thank you.